Hi everyone, welcome to our first episode of our Foundation Training Pharmacist podcasts. My name's Amir and I'm from the RPS. Today in this podcast, we're going to be focusing on the key milestones in our training, what you can look forward to, and any possible challenges that you may face and how you can possibly overcome them. I'm joined by two guests today. I've got Christian and Khalid. Would you guys like to introduce yourself?
Yeah, shall I go first? My name's Khalid, and I am the training lead for a community pharmacy chain, Iman Healthcare. And I also am a training program director for Health Education in England, again, to do with foundation trainee pharmacists.
Thanks, Khalid.
And I think I'm off mute. So my name is Krish. I am a recently qualified pharmacist. I am currently back at University of Huddersfield, completing my PhD in a novel biopolymers for pharmaceutical means.
Krish, Khalid tried to explain to me what your PhD was doing before you joined the call.
Yeah,
and he gave very quickly.
I don't know how much you want me to go in depth. I'm basically using a biopolymer, and I'm using it to allow it to stick to the mucosa of the gastric system of the stomach to allow the release of an anti-cancer drug. So it's to do targeted anti-cancer therapy.
Wow. And you did your training with Khalid, is that right?
Yeah, I did. So my training was with Checkfield Pharmacy in Pontefract and at a GP surgery in Leeds called Colton Mill Medical Centre. So yeah, that was I had a GP split, which I was quite fortunate to have.
Brilliant. I suppose for me and for our listeners, it will be really great to hear both of your views on what you can expect from your training year. And as I mentioned in our short and brief intro, any tips for success that you can have during those years. We know that trainees, when they start this year and they embark upon this journey, it's all very different for them. So they've come out from university and they've entered the working world, and people have some really mixed views about that. Some of them can feel really happy and excited. Some of them, I think, a little bit apprehensive, a little bit worried. And for me, it's all okay to have those feelings because, as I've said, it's new. And I think the traditional training method has obviously evolved because of COVID, and the world has changed over the last 2 years. And I suppose that probably is a great segue into the first question that I really wanted to ask you guys, which was, so what advice would you give prospective trainees? So they've just started, and what advice would you give them? Any key top tips?
I think with just starting the foundation training year, it's really important that you do it the way you want to do. I think you can talk to previous students who are pre-registration pharmacists, and they'll give you their insight into how they did it. But I think it's really important that you find your way. And you really make a good relationship with your supervisors. I think that's really important as well. And you don't need to have a clear-cut plan right at the start, because you've just come out of university. You're being sat in lecture halls, being spoon-fed all this information, and you're going straight into working life, and you're expected to, work 9 till 5 and go home, revise, do all that stuff, and to put that amount of pressure on to have a clear-cut plan so quickly into the foundation year, I think is quite a lot of pressure. So I think it's about taking your time and communicating with your tutor quite a bit about what you want from the year and how you want it to go, and kind of having a collaboration and establishing that collaboration as soon as possible.
That's great. That's really, really helpful. Khalid, would you agree with those points?
Yeah, I think that's been really well put by Krish, actually. And Krish was a very good example of somebody who was very clear about what he wanted to achieve, and actually quite clear about how he wanted to achieve it as well. And it was a case of, it's not just about doing whatever the trainee wants, but it's about figuring out how we can achieve everyone's objectives at the same time. So the trainee comes in, they've got their objectives for the year. The supervisor has their objectives, because they're not just supervisor, they're a pharmacist and they're managing, etc. And then you've also got the team around the trainee as well. So the people that they're working with, it's important that as well as having a good relationship with the supervisor, they have a good relationship with all the other members of the team as well. And that you understand what their objectives are during each day and the week and the year. And I think what's very helpful is that if you can embed yourself in that team and have a good working relationship with everyone and help everybody else with their own objectives, what then tends to happen is when it comes to you needing your study time, for example, or needing some time to look at something, or you'll find they're going to be more collaborative and more supportive of that because you've helped them with their job. So I think it is an exciting year, and trainees should be going into it very excited. Different trainees will come with different levels of experience. So what you don't want to do is compare yourself with other trainees or your friends who may have been working for, the local pharmacy for 4 years or whatever. They're going to start at a very different level. So just have a think about what you want to achieve in your year, and then work with your supervisor to achieve it. But enjoy the year, because you only have it once, to make the most of it.
Yeah, to go off what Callie's just said about enjoying the year, it's really important. I think now I'm a qualified pharmacist, I kind of sometimes think back to my pre-reg where, you're bound to make mistakes. Whilst you're learning on the job and you're being put under certain pressures. I was working in a very busy pharmacy. There are times where I would get it wrong, and then I'd reflect on it. I'd talk to my supervisor about it and just see how I could improve, really. And it's all about, like Callie said, just enjoying the experience and kind of taking every opportunity that's being given to you. You have that support. You have that support with your supervisor, so you have that safety net, and that can kind of give you kind of a license to not take unnecessary risk, but to kind of step out the comfort zone at times, because that's what you're going to be doing as a daily pharmacist. You're going to be stepping out your comfort zone at times. There may be things that come across in daily pharmacy life that you've not come across before, and it's really good to try to take those opportunities in foundation pharmacy year and really just take hold of the opportunities and know that your supervisor is there to support you and help you get further.
I think just one more thing to remember is that no one's going to care about your foundation training year more than you, and no one's going to think about it more than you. So it's very important that you take it by the scruff of the neck, and that you are very curious, and that you're asking questions, and that you're not waiting for somebody else to push you to start your learning and asking questions because everyone's busy doing other things. So I worked with a couple of trainees just a couple of days ago. I don't do it very often, but it was quite nice. And you could see they'd almost gone into autopilot mode in terms of dispensing and getting on with the day-to-day, and they weren't asking questions. And when I was asking them questions about what they were doing, they didn't know the answer. And that didn't bother me. I didn't know that. What bothered me was they didn't ask and they weren't curious about it. So you need to really kind of, from day one, avoid getting to that autopilot mode of just coasting through the year and making sure you understand what's going on around you.
That's a great point there, because one of the questions that I was going to ask is that as Krish was describing some of his top tips, I think I absolutely agree with everything that's said. But I think often we hear that trainees are a little bit apprehensive because they've come from a university environment where deadlines are given to them, so they are told you've got this coursework to submit on this date, and these are the people that are available to you. So it's a very academic and a very professional relationship. And I think when we consider the relationship between trainee and supervisor, it's still a very professional relationship. But Khalid, what you've described about people going into autopilot and dispensing and doing the ordering and doing all of that stuff, I hear that quite frequently. And what I really wanted to know was, you both mentioned about building relationships, and it's your year, and definitely taking that by the scruff of the neck and doing, I suppose, the stuff that is important to you. But what tips have you got when some of the relationships break down, or when you don't see eye to eye with your tutor, or the trainee is saying, I really want to do this, and the supervisor is saying, your time will come for that, or some of those more complex examples?
Shall I go first on that one? We see that, we see that kind of thing happening every year, and it happens in every sector and every setting. It's quite common, and communication is the key, isn't it? Is as soon as you have a concern or a worry, something you're not quite comfortable with, have that conversation. The first person you should have that conversation with is your supervisor, because part of the is developing that, as Chris said, developing that relationship with the supervisor, and that happens through discussing things with them. It's a good idea to maybe have a plan of what you're going to discuss and how you're going to phrase it, how you're going to word it, what sort of tone you're going to use. Because what you don't want to do is go in all guns blazing and sound quite accusatory or like you're pointing the finger, but more kind of, I'm thinking this, and I've got this concern or this worry, and I'm wondering kind of, do you have any advice on how I can remedy it? Or actually, I've got a solution, what do you think? And make it a two-way conversation, be very respectful about it. And that in itself is a developmental process. You'll develop professionally from that, and it'll be very good. Now, sometimes if the outcome may not be great for whatever reason, because there might be a personality clash or whatever, again, it's important to know at the beginning of the year what your support structures are and what your lines of communication are. So if something goes wrong with your supervisor and you can't sort it out between yourselves, who's the next person you want to go to? Is it a line manager, or do you have a training lead, or what we call these days an educational program director, an EPD, within the company who you can go to, can maybe give you some advice, go back to how to have that conversation with your supervisor. And actually, maybe in the first instance, if you're a little bit intimidated because you've not worked before, you've not had that relationship with somebody in a working place, it might be worth going to your another line manager or your training lead, say, I'm having this concern. How do you think I should approach it with the supervisor? And they can kind of give you some tips. And like I said, if it doesn't work with your supervisor, have a chat with a line manager, EPD, and maybe they can mediate if necessary. Hopefully it doesn't get that far. Hopefully it's not that serious. But if it does, and if you don't have that facility, there are other ways. So some students still have good connections with the university or their academic tutor. So you'll find they'll, if they have a good relationship, they can go back to them and get some advice from them, because they're usually pharmacists or practicing pharmacists, and they can give you some advice. And the other organisation to look to is Pharmacy Support, which I know the RPS is well linked with, and it's the official charity for pharmacy professionals. And actually, if you look at the stats from Pharmacy Support, even though trainee pharmacists make up the smallest group of their membership, they make up proportionally the largest number of queries that they get from that group. And that's an anonymous, kind of very safe place to go if you want some advice on various things.
Yeah, I completely agree with Khalid. I never had to use Pharmacy Support, but they made sure that they knew that they were there. And it's good that they kept on re-emphasizing that they are there, because I think sometimes trainees can kind of forget that there's someone always there. You might have friends you can talk to and people you can talk to, but when it comes to your professional development, sometimes you actually want kind of you want someone who might be understanding what you're going through. During my training year, I wasn't subject to many problems with my tutors. They were both fantastic tutors, so I never really had such problems. But there were sometimes disagreements on like where I thought I was and like what I thought I could do, and I think sometimes that's just out of naivety at times, because when you're going to uni training year, you think you know everything. You don't know everything. There's a difference between seeing it on a lecture board and then actually happening in practice. And I think one thing that I always told myself is, if my tutor believes that, my supervisor believes that I'm not ready for it, just trust them on it, because they have a plan. Your supervisor will have a plan. They're doing it for your safety as well as the patient safety, but they do have a plan. And as long as they're communicating that plan with you and they're not just springing it on you, you shouldn't really encounter many problems. And I think it goes back to that one word of communication right at the start of the year on what your set plan is. And sometimes things can shift. Your supervisor may think, okay, I don't think he's ready just yet for this. Maybe we'll try it again next month. And that's not something to be disheartened by, because you may have excelled in other areas that they thought, would have come later. So for myself, whilst I was in GP, and especially during COVID, my skills of communication with a patient one-on-one were not there, because I was talking to patients over the phone, and that is a skill in itself, talking to a patient over the phone, because you're not getting any visual cues off them. You're kind of just hoping that whatever they're saying, there is a sort of an understanding and agreement. So when I did have my first patient come in, I was quite scared, to be fair, because you got a patient in front of you. You don't really, you have OSCEs and stuff at university, but when you have an actual patient in front of you, it can get quite daunting. And after I reflected back on with my supervisor, she said that maybe this is something that I want to sit in a few more consultations with. I think at that time I kind of knew that I wasn't ready for that, so I just communicated that to her. And just said I want to sit in with some more of your consultations so I can learn a bit more and then go back into my own. And that's how we kind of resolved that one, because she was trying to push me just that bit further, because I think she knew that I could do it, but I didn't feel that I could do it myself. And I just wanted to see a few more consultations and how they worked out.
Can I just come in? There's something really important here about trainees being very honest about what sort of support they need from day one. So one thing we encourage with our tutors is the use of something that medics use, or sort of trainees in medicine use, which is called the kiddie ring interview structure. And what that is, it talks about your kind of what the current role is going to be, what your aspirations are as a trainee, but it also delves into kind of your history as well, kind of what work experience you've had. Do you have anything that might affect you, like medical conditions? What's your family situation like? Now, it's up to the trainee to divulge what they're comfortable with, obviously. But the more you can divulge to your supervisor, the more they understand your background. And it's about enabling your supervisor to see you as a whole person and not just a trainee pharmacist. So if you have a medical condition that might be affecting your work, whether it's every day on an intermittent basis, or maybe you have a learning difficulty, dyslexia, ADHD, whatever, these things may impact on how you perform. And if your supervisor is not aware of that, they're going to mark you quite harshly and be quite strict with you. But if they understand that you've got these medical conditions, or maybe you've got financial difficulties at home, or you've got caring pressures or something like that, then if you come in and you're having a bad day, your supervisor's not just thinking, well, Chris is in a bad mood, what's up with him? They're going to also think, oh, maybe something's going on. I'll have a little word and see if he's okay. It becomes a very different conversation, a very different experience. So I think, self-declaring that with what you're comfortable with your supervisors, good for yourself as a trainee, makes things much easier for you.
I'm really glad you said that, because one of the next questions that I was going to ask was just around work-life balance and well-being. So I touched upon it briefly already, but I described earlier where we hear people say that they've come out of uni and they're doing a working job. So Chris already described a 9 to 5, but it might not be a 9 to 5. It might be an 8 to 8. It might be an 8 to 7. It could be a Saturday or a Sunday. It could be like holidays. And there's a lot on, right? And I think for me, it'd be really, really good to, I suppose, just highlight some of the top tips that we can let our listeners know around how you juggle some of that work-life balance, and how you can help plan and prioritize some of the stuff that trainees have got going on. Because you're absolutely right, it is their year, and it's something that they only get a chance of doing once. So there are obviously other things, there are competing pressures, and I think it'd be really great to hear from you both any top tips that you've got around competing challenges and managing a work-life balance. Chris, can we come to you first?
Yeah. So during my training year, I had some that my grandfather was recently diagnosed with dementia and things like that. So that was a competing pressure for me. I think anyone who, I'm sure people know about dementia, it's not very easy on the family as well as the patient. And that was one thing that I highlighted straight to my tutor, and we talked about it, and my tutor was very supportive of that sometimes I would have to just take a break, because at times I would kind of just get worked over at times. Sometimes I would be a bit down, and he would understand that. And I think that's one thing, personal issues, to talk about with your tutor is not a bad thing. Even though it's personal, you may, if you have that relationship with your tutor, that you can talk to them, because my tutor I saw as not just a colleague but as a friend, because of that's the type of relationship we had with each other. We had laughs, but whilst working, but also I could go to him comfortably and tell him about all this stuff. So I think, yeah, personal issues is firstly one thing that you should try negotiate with your tutors and tell them about how you are feeling away from work life. When you come out of university, it will be a massive shock, going to a full-time job, knowing that you got an exam right at the end of the year that will dictate whether you are going to be a pharmacist or not, and obviously have more tries, but everyone wants to nail it on the first go, but it's not something you want to relive for 3 times. So you automatically have that pressure on your back, and I think sometimes that can really get on top of you. And I would be lying if I said that it didn't get on top of me, and I'm sure there's other people who got on top of. But what I did to get past that was sometimes I call it a winning mentality. I come from a field of sports where just don't give in. Whatever you do, just don't give in. And that's what I always had in my mind, that, just keep a winning mentality. It will get easier. As soon as the staff who you're working with, you got a better relationship with your supervisor, it all gets a lot more easier, because you can talk to them. They will tell you stuff on how to help with the exam, because they've probably seen other pre-reg students and it's nothing new for them. So if they've already done it before, they can give you tips on how the other pre-reg negotiated the year. And it's really good to take in all that advice, even if you don't use it, or you disagree with it a bit, at least you know about it. And I think that's something that's really important, that you just take in as much advice as you can and find out what is the best fit for you. But yeah, it is a shock, and I won't lie about that. The pre-registration year, it can be hard, but with the right support network, and it becomes a lot easier in the end, and you become a lot more confident and mature about how you are as a person as you go on through the year.
Yeah, I mean, I think Chris's points are going to be much more valuable than mine, because he's the guy who's been through it, and I went through it a long time ago. But from my experience, trainees need to remember that it's a marathon, not a sprint. They need to really pace themselves throughout the year. I mean, saying that, it goes past really quickly. But if you start obsessing about the exam and panicking about the exam from day one, and kind of really throwing yourself into revision from day one, quite heavy, you'll burn out. There's no way you can keep that pace up until the end. So there's something about, yes, preparing in advance, but I know Chris was really good at it. But I wasn't Chris's supervisor. He had another one who was great. But I dealt with Chris quite a lot, and I remember he had kind of a revision timetable quite early on. But I think it was sensibly paced and not too heavy. So that's one thing. But in terms of looking after yourself, you need to take time off. You need to enjoy your time off, enjoy your weekends. Yes, you'll have to do some studying in your free time as well. That's just the way the year is. But the time you have off, make the most of it. I know some trainees, because they're so panicked about the exam, they will save up all the holidays, all their annual leave until just before the exam to take it off for revision. And in my experience, that just isn't needed. Usually a couple of weeks is enough for that intense revision for the exam. Save up your other annual leave and take regular breaks off. Take a week off, after a few months, another week off after a month, to kind of recharge your batteries and just switch yourself off in that time. And that's really important, because if you burn out before the exam, then it's quite hard to get yourself in tip-top shape and in the zone for the assessment itself.
Yeah, I was one of those that fell into the trap of, saving up all my annual leave till the end. Luckily, I wasn't a burnt out type of student. I did have my own chill time and, spent time with friends. That's one thing to really highlight on that. Your weekends are your weekends. You obviously, some weekends you may be writing up evidences or doing a bit of light work, but just make sure that the Saturday and the Sunday are for yourself, because that's what working life is, the Saturday and Sunday for yourself. If you want to do work, just try to say even half an hour a day of work after work, whether it's just reading, say, the hypertension guidelines or the asthma guidelines. Something will stick, but that's not saying do it every day. Sometimes you just want to go home, just watch some TV and then just go to bed, or you want to go out afterwards. Don't feel guilty about that. I felt quite guilty at the start, because I should be working right now, and just try to get out of that mindset, because the only thing that you're compromising is actually your own mental health. And, you know, mental health is becoming a lot more talked about these days. And I think during my pre-registration year, it was probably highlighted more to me because it's a tough year, and especially during COVID. And I think, you know, everyone talks about mental health for healthcare professionals during COVID. It's the same for trainee pharmacists because there is that added pressure of the exam. So just take time for yourselves. You know, Khalid said that the year goes by fast. It does go by fast, but there's also time as well. You know, there is a lot of time for you to just filter in knowledge, learn on the go. And there's nothing better than learning on the go. You know, you could read the hypertension guidelines, or you could answer a query, a doctor ring you up and answering a query, and there you go, you've learned the hypertension guidelines, but you just screened over it and you just told someone, and that's how you also get your evidences in. So yeah, I know that's a bit off topic, but try just be efficient with your time, because if you're efficient with your time, you'll then have a lot more chill time, which is what we all want as well during the year.
I would absolutely agree, and I wouldn't say it's off topic at all. I think it's a really good point that you made. Is your time is valuable, and you need to use and utilize your time well. And I think it is fine. A lot of trainees say, I need to be working 18 hours a day or whatever it is, and it's just not sustainable. It's not achievable. Yeah. People get burnt out. And I'm really glad that you mentioned mental health and well-being as well, because in my time, I was a trainee 11 years ago. Seems like ages ago now, but going from being a trainee to being a tutor to being a group training supervisor, yeah, I'm really pleased that mental health and all of this stuff is being discussed more openly, because people don't plan it, and it's an opportunity to contextualize and apply what you've learned in university, but also on the job. I suppose that's a good point to stop and just summarize some of the top tips. So I'm going to try and summarize, because you guys mentioned so much. But I think for me, one of the key things that you both said was this year is really all about relationships. It's about the relationships with your supervisor. It's about the relationships with your team. And most importantly, it's about the relationships with yourselves. So if there is an opportunity to highlight something that's perhaps not going so well, then think about how you're going to have that conversation with your support network, be it your friends, or be it your tutor, be it your line manager, or be it a trusted advisor or colleague. Khalid mentioned something about being curious, which was around, it's really easy in this year to just, I suppose, knuckle down and dispense and do the job that is needed. But this is your year. It's an opportunity for you to be able to learn and ask those interesting questions that perhaps you may never have again. It's an opportunity for you to be able to ask and say, why is it done in this way, or why is it done that way? And that's not just about the clinical competence, but also about some processes too. I think the last thing that came through really well and strongly for me was that you really need to communicate. So communicate, as I've said, with your team and with your colleagues, and think about the stuff that's going well and not so well. That's been great. And I really wanted to, again, thank you both for your time today to discuss the training year. I want to thank the listeners. Thank you for listening. And in our next episode, we'll be focusing on the trainee learning standards and what they are, how to gather the evidence, and how to demonstrate them. Thanks all.